My name is Sarah Kute, and I am a nurse. I've been nursing for about 15 years now. I worked about 14 years in intensive care unit, but very recently, as recent as last year, November, I've been working in pre-op assessment. This is an area where I assess patients. Most of them would have had life-changing, some of them have told me devastating diagnosis, and they would come. I'd have to assess them before they have their surgery. I'm very passionate about nursing, and the reason I am is because hospitals are it's not a usual environment, and it's the sort of place that makes some people just feel out of place. What nursing does is it gives me that opportunity to just step into the patient's shoes for that moment while they're there, discuss their diagnosis with them, talk to them, and probably encourage them and empower them, reassure them that things are not quite as bad as they may be, and especially if I have to talk about the surgery that they are having. So it's something that I enjoy very, very much. My job was in the pre-op assessment department was just going through the questionnaire with the patients, and there is an aspect in those questionnaires where I'd have to deal with religion. A patient could either state their religion or not, and that would always bring about most of the time from the patient about what religion they are. And I discussed my religion with the patient and how I found Jesus Christ and how much peace I have, especially when patients come to me feeling really, really devastated sometimes. And I have had to reassure them based on the joy and peace that I really have found in the Lord. One afternoon, my manager went into my office and she said that she'd had a few complaints from patients that I have had religious conversations with them. And I explained to her that this only comes about when I have to go through the questionnaire with the patient, because on the questionnaire there's an area where we have the patient had to state their religion, and that could prompt a conversation. So, and she said not to. I said okay. I think that the next day I got a letter from her, and in the letter she stated that I could have some religious discussion with the patients, or if the patient asks for it. And from that moment on, if the patient initiates the question, or I have to go through again the pre-op questionnaire that has to do with religion, I'd always say to the patient or ask the patient if they were comfortable, and most of them were. I was investigated, and unfortunately for me, I wasn't allowed to bring any witnesses at all, so I couldn't really test the evidence that were given by the patients or what complaints they made. And I have now lost my job. I've been dismissed since August this year, and that has really just exposed to me to not just financial poverty, but possible homelessness. I want to challenge the decision that's been taken by my employers, because I believe it's a very punitive action that was taken due to the fact that I've got 15 years of exemplary nursing, and I have worked in this trust for about 9 years until very recently when I went to another department. And my colleagues whom I worked with say I'm a brilliant nurse, that I have brought a different flair to the unit where I work at the moment. And nursing itself really, it's not just about physical care. It's about holistically looking at every aspect that involves that patient's care, and religion is one of them. And so how could telling anyone about Jesus Christ really be harmful to any patient?